The human heart, a tireless pump, doesn't beat solely on its own. It relies on intricate signals and inputs to maintain its rhythm and efficiency. It receives constant input from the sympathetic nervous system, which plays a crucial role in regulating heart rate and blood pressure, ensuring the heart responds appropriately to the body's needs. Adrenaline, a powerful hormone released in response to stress or excitement, binds to beta receptors on the heart muscle, initiating a series of physiological changes. These receptors act like doorways, and when adrenaline unlocks them, it sets off a cascade of events within the heart cells, leading to increased heart rate and force of contraction. This interaction is essential for the body's fight or flight response, a survival mechanism that prepares the body to face or escape danger. Imagine encountering a dangerous situation. Your heart rate and blood pressure surge, preparing you to either confront the threat or flee to safety. This rapid response is crucial for survival. Understanding beta receptors is fundamental to grasping the mechanism of beta blockers, medications prescribed for cardiovascular conditions such as hypertension and arrhythmias. By blocking adrenaline, beta blockers slow down the heart rate and reduce blood pressure, providing relief and protection for patients with heart conditions, ultimately improving their quality of life. The fight or flight response is a physiological marvel, an ancient survival mechanism. At its core lies adrenaline, produced by the adrenal glands. When faced with a threat, the sympathetic nervous system triggers the release of adrenaline into the bloodstream. This surge acts as a chemical alarm bell, alerting the body to prepare for action. Adrenaline binds to beta receptors on the heart muscle, increasing heart rate and contraction force. This results in a surge of blood flow, delivering oxygen and nutrients to muscles and vital organs. While essential for survival, chronic activation of this system can harm cardiovascular health. Beta blockers modulate the heart's response to stress, protecting it from chronic adrenaline exposure. Beta receptors, the gatekeepers of adrenaline's effects, exist in two main subtypes, beta 1 and beta 2. These receptors play crucial roles in how our body responds to stress and various stimuli. Beta 1 receptors are predominantly found in the heart, where they regulate heart rate and strength of contraction. On the other hand, beta 2 receptors are located in the lungs, blood vessels, and other organs, influencing a variety of physiological responses. Stimulation of beta 1 receptors by adrenaline increases heart rate and contraction force, preparing the body for fight or flight situations. Blocking these receptors with beta blockers slows down the heart rate and reduces the workload on the heart, which is beneficial for patients with certain cardiovascular conditions. Beta 2 receptors mediate different responses, such as bronchodilation in the lungs, which helps to open the airways and improve breathing. This effect is used in treating asthma with beta 2 agonists, which help to relieve symptoms by relaxing the muscles around the airways. However, blocking beta 2 receptors can lead to bronchoconstriction, a concern for individuals with asthma or COPD, as it can make breathing more difficult. Understanding these pathways is key to the specific actions of different beta blocker medications, allowing healthcare professionals to tailor treatments to individual patient needs and conditions. Beta blockers act as antagonists at beta receptors, blocking adrenaline and noradrenaline. They dampen the sympathetic nervous system's influence on the heart, decreasing heart rate and blood pressure. This mechanism makes beta blockers invaluable in treating cardiovascular conditions. In hypertension, beta blockers help relax blood vessels and reduce the heart's workload. In angina, they decrease the heart's oxygen demand, reducing chest pain. Beta blockers also prevent migraines, manage arrhythmias, and reduce anxiety symptoms. The world of beta blockers encompasses a diverse array of medications with different selectivity for beta receptor subtypes. Non-selective beta blockers bind to both beta 1 and beta 2 receptors, affecting the heart and other organs. Cardioselective beta blockers primarily target beta-1 receptors in the heart. Non-selective beta blockers can trigger bronchospasm in individuals with asthma or COPD. Cardioselective beta blockers carry a lower risk of respiratory side effects, making them safer for patients with respiratory conditions. The choice between non-selective and cardioselective beta blockers depends on the patient's needs and medical history. Factors like asthma, COPD, and diabetes play a crucial role in guiding this decision. Treatment is tailored to minimize risks while maximizing therapeutic benefits. Beta blockers modulate the heart's response to stress, earning a place in managing various cardiovascular conditions. In hypertension, they lower blood pressure by reducing the heart's output and relaxing blood vessels. This alleviates strain on the heart and reduces the risk of complications like stroke and heart attack. In heart failure, beta blockers improve the heart's pumping efficiency and reduce the risk of life-threatening rhythms. They also manage abnormal heart rhythms, particularly atrial fibrillation, by slowing the heart rate. Beta blockers reduce the frequency and severity of angina episodes by decreasing the heart's oxygen demand. Their multifaceted actions make them invaluable in cardiovascular care. While beta blockers offer significant benefits, they come with potential side effects. Common side effects include fatigue, dizziness, cold hands and feet, and slow heart rate. These effects are often mild and subside as the body adjusts. More severe side effects, such as worsening asthma symptoms, erectile dysfunction, and depression, require careful monitoring. Individuals with asthma or COPD need monitoring for bronchospasm, a serious side effect. Diabetics should be aware that beta blockers can mask symptoms of low blood sugar, requiring careful glucose monitoring. Open communication with healthcare providers about pre-existing conditions is crucial before starting beta blockers. Prescribing beta blockers to individuals with chronic conditions like asthma, COPD, and diabetes requires careful consideration. These medications, while beneficial for heart conditions, can have significant impacts on respiratory and metabolic health. Non-selective beta blockers can worsen symptoms in asthma and COPD by blocking beta-2 receptors in the lungs, which are crucial for keeping airways open. This can lead to bronchospasm, triggering shortness of breath and wheezing, making it difficult for patients to breathe comfortably. Cardioselective beta blockers are generally safer for these patients, but still require careful monitoring for any respiratory side effects that may arise. In diabetes, beta blockers can mask symptoms of hypoglycemia, a dangerous drop in blood sugar, which can be life-threatening if not detected early. This occurs because beta blockers block the body's natural response to low blood sugar, such as increased heart rate and tremors, making it harder to recognize the warning signs. Open communication between healthcare providers and patients is crucial in navigating these challenges, ensuring that any potential issues are addressed promptly. A thorough assessment of the patient's medical history and potential risks ensures safe and effective treatment, tailored to the individual's specific health needs and conditions. Patient education is integral to beta blocker therapy success. Empowering patients with knowledge about their medication, managing side effects, and adhering to the regimen is crucial. Patients should be educated about the medication's purpose, benefits, and potential side effects. They should understand common side effects like fatigue and dizziness, and know when to seek medical attention. Medication adherence is crucial for beta blockers to be effective. Patients should establish a routine for taking their medication and use reminders to enhance adherence. Regular monitoring of vital signs, such as blood pressure and heart rate, is essential. Follow-up appointments with healthcare providers assess treatment effectiveness and make necessary adjustments. Nursing students often encounter questions about beta blockers in their pharmacology exams. These questions assess their understanding of the medication's actions, uses, and potential complications. Examples include describing the mechanism of action of beta blockers and differentiating between cardioselective and non-selective types. Students may be asked to list conditions treated with beta blockers and outline potential side effects. They should explain why beta blockers are used cautiously in patients with asthma, COPD, or diabetes. Key patient education points for individuals starting on beta blockers are also common exam topics. Successfully answering these questions requires a deep understanding of beta blockers and their clinical considerations. Beta blockers modulate the heart's response to stress, revolutionizing cardiovascular treatment. From hypertension and heart failure to arrhythmias and angina, these medications improve quality of life. Understanding beta blocker therapy, from subtypes to side effects, is crucial for healthcare providers. Patient-specific considerations, especially in chronic conditions like asthma, COPD, and diabetes, ensure safe treatment. Empowering patients with knowledge fosters a collaborative approach to therapy. Through education and open communication, healthcare providers maximize benefits while minimizing risks. Beta blockers remain a vital tool in navigating heart health challenges.